Hello, everyone. My name is Trevor Tamura. I'm in the College of Arts and Sciences. I'm studying biology, specializing in cellular, molecular, and genetic biology. I'd like to thank my advisor, Dr. Sophie Godley, in the School of Public Health for all her help and guidance throughout this project. My project is titled Telemedicine in Hawaii's Pediatric Care System, an analysis of its impact during the COVID-19 pandemic. Before we get started, I'd like to do a quick poll of the room. Just to see, by a raise of hands, who here has had a telemedicine appointment before the pandemic, before 2020? Okay, a couple people. How about who here has had a telemedicine appointment in the past 2 years? Yeah, so I fall in there as well. My first telemedicine appointment was back in 2020. And that actually follows a lot of what the nationwide trends are. So this data is coming from the CDC. As you can see here, I'm focusing on March 2020 as sort of the framework for my project, calling that the beginning of the pandemic. So as you can see from March 2020 on, there's a drastic increase in the number of telemedicine encounters that happened. And this trend is actually corresponds to Hawaii as well. For this project, I'm focusing specifically on more of the synchronous and audio, the synchronous visual and audio patient services that were offered. But across the board, you can see that as the pandemic was starting, a lot of these services were being offered at a higher rate just because the telemedicine infrastructure across the board was being increased. This survey took place in May of 2020 by the Hawaii Emergency Management Agency. So again, near the beginning of the pandemic. When I'm talking about telemedicine, I'm referring to healthcare services that were provided through telecommunications technology by a healthcare professional who is at a location other than where the covered person is located. This definition comes straight from the Hawaii State Legislature. One of the reasons why I'm actually focusing on Hawaii is that they have actually had an existing progressive telemedicine policy that dates back to 2016. They passed a parity statute that basically said that telemedicine services needed to be reimbursed at the same rate as similar services that were offered in person. So my research questions that I'm framing this project around starts by looking at the state of youth healthcare in Hawaii right now. What are the major disparities and barriers that youth face on a daily basis to receive adequate care? Because in order to understand how telemedicine can and will impact that in the future, you need to understand what youth are going through on a daily basis. Next, I'm looking at how has the increased usage of telemedicine throughout the pandemic influenced the way that pediatric care is delivered. And lastly, looking forward, what needs to occur to make pediatric telemedicine more effective and successful for patients and providers? The way that I conducted my project was I first started with a set of qualitative interviews. I interviewed five pediatric physicians, 4 of which were general pediatricians, 1 was a pediatric specialist. And from these interviews, I generated a code book that consisted of concepts that I saw were referenced throughout, and I later grouped those into themes. From this code book, I took those concepts that were coming up and I used it to drive my literature review, basically seeing if what the physicians were talking about supported what was also in the literature. So the things that I focused on with my literature review started with telemedicine coverage by health insurance companies. Basically, what I found was that the way that healthcare is paid for directly impacts the way that healthcare is delivered. I then looked at some of the major disparities that I've been talking about, and I looked at the accessible public health data from Hawaii Health Matters, and I tried to see what were the disparities that the physicians were talking about, and did the public health data support what they were saying. So these interviews, this is an example of my code book. I took some of these concepts, or codes as I called them, and I basically saw what were the ones that were appearing most often. I developed those, and then I grouped those codes into themes, as you can see to the right. For every code, I listed a description, basically going deeper into what the physicians were talking about. And then lastly, I provided a direct quote or an example of what the physicians were referring to when they talked about these various codes. Lastly, I also, out of the 5 physicians, I also said which one of them spoke about these codes to some degree, to some extent. My major findings from these interviews, starting with the pros, was that it provided a lot of reassurance for parents. One of the unique things about pediatric care is that physicians aren't just dealing with patients, but they're also dealing with parents and the family unit as a whole, because usually kids aren't able to describe necessarily where it hurts or what needs to be looked at. So in a time when anxieties were high because parents weren't able to, talk to their physician in person, telemedicine actually provided a lot of reassurance, even if it was just a quick video call or even a quick phone call. Going off of that point, these phone calls or audio-only cares plus pictures that were uploaded actually proved to be a very useful method of virtual care. For example, uploading a picture of a rash and getting that examined and getting a follow-up via phone call actually cut down on a lot of unnecessary in-person visits, and a lot of physicians are actually still using that from my interviewees. So it's kind of cool to see how that actually is able to address some of these physical barriers that I found. Some of these physical barriers that were actually decreased because of these different telemedicine services that were offered are things like transportation, where kids who live maybe on the west side of Oahu have to travel far and maybe don't have the resources to travel every single day. Things like wait times, where in Hawaii, they actually have a shortage of pediatric specialists. So wait times could be somewhere up to a year to see a certain specialist. During the pandemic, telemedicine cut that down to a couple of months. And lastly, kids who live on neighbor islands, they actually have to travel to Oahu because that houses the main pediatric care facilities. So telemedicine was able to make sure that they don't have to travel every time they needed certain levels of care. Some of the cons, though, is that there was less incentives from insurance companies to provide telemedicine versus in-person care. So if physicians weren't getting reimbursement, they just wanted to provide in-person care, right? There's no incentive behind telemedicine visits, even if there were benefits behind them. Secondly, physical assessments are very necessary for kids. That was a common theme across the board when talking to these physicians. And lastly, technology errors actually led to less efficient care. If you take a 30-minute appointment, up to 15 minutes of that could be internet issues, forgetting your password, not being able to join the link, and that just leads to less time with the patient and less quality care across the board. So I mentioned that I took these concepts from my codebook and I went to the literature. So I looked at 10 relevant disparities from Hawaii Health Matters, and I wanted to see if the literature was supporting what the physicians were talking about. What you can see over here refers to the lack of care and being able to see physicians on a daily basis. The number that I'm pointing out was actually something that was mentioned by one of the physicians. Kids who live on the west side of Oahu may actually have less resources and less access to physicians. Kids who fall into this certain demographic of Pacific Islander. So that was kind of cool to see how the literature was supporting what the physicians were saying. On top of that, I looked at insurance because, as I found, insurance was heavily impactful in driving which telemedicine services were being offered in the first place. HMSA and Kaiser are the two largest commercial healthcare providers in the state, and they covered all telemedicine visits up until January 2021, and they're currently covering all audio-only visits up until May 2022. So because of that, you see the majority of the population in Hawaii is under these two health insurance, but they're only covering audio-only right now. So that limits the amount of telemedicine services that physicians are willing to provide. On the other hand, you have the smaller population, Quest, or the Medicaid patients. They currently cover all forms of telemedicine. But certain specialists actually aren't taking Quest patients right now. So this provides sort of a dichotomy for the physicians to work through, where you have two separate patient workflows on a daily basis. Do you split it up where some of them you take telemedicine visits, some of them you take in-person visits, and that would just mean more work for them across the board. So what did I find from this, from my project? Well, first off, I saw that telemedicine is actually addressing a lot of the major needs for Hawaii's pediatric healthcare system, as I saw in the past 2 years. But continued insurance coverage is necessary to incentivize physicians to continue to use it, even if it's just the audio only plus uploaded pictures. And looking forward, more research needs to be done into this. There needs to be a bigger physician population that's looked at, more than just the 5 that I talked to. But also they need to speak with patients themselves because they're a part of this equation as well. And telemedicine needs to equally benefit them to be a part of this, to be a part of Hawaii's pediatric healthcare system moving forward. Thank you.
So questions for Trevor? Hi, so you mentioned a lot of pros and cons to telemedicine, especially right now. And moving forward, as the pandemic hopefully goes away, do you see a way for us to retain the positives of telehealth while also not limiting it to that and making sure that patients are getting properly treated in person?
Yeah, absolutely. As I mentioned, after doing this project, I'm a huge supporter of continuing to cover audio-only services because it cuts down on the unnecessary visits. Say, if your kid has a rash, right? You don't have to travel all the way into town, back home in Hawaii, to get checked out on a rash. You could send in a picture, you could call your physician, and that cuts down on that stuff. That opens up more opportunities for the physician to deal with other patients, and then that also cuts down on maybe some of the costs to travel in, sitting in traffic, things like that. So I definitely think finding that balance between in-person visits and continuing to use audio-only calls will be really helpful moving forward.
So Trevor, I was intrigued at the beginning. You said Hawaii, I think back in 2016, was already doing telemedicine. And is it because it's an island nation, or do you know why?
I think that actually played a part in it because, a lot of the healthcare services are offered on Oahu, the main island. But the caveat to that, even though that they were offering that parity statute, there still weren't a lot of telemedicine services offered. Yeah, maybe they had the same levels of reimbursement, but the infrastructure across the board wasn't at where it is now. So it wasn't as prevalent as it has been in the past 2 years. Yeah.
I was just curious why the kind of split between the audio and the video and audio. Why was that split out, and a lot of insurance companies only covering the audio and not video calls?
Yeah. One of the major problems, at least that I saw from the physician's point of view with video calls, is that you had to make it secure, right? It had to be a secure platform. You couldn't really use Skype or FaceTime or Zoom. So that meant for each of the insurance providers, they had to have their own visual platforms, and they were super buggy. There's a lot of technology errors that came with it. I'm not sure if you guys have experienced that at all, but that was a huge problem in Hawaii. So I think because of those issues, the insurance companies were just like, yeah, we're not going to cover that anymore. It's too much, and it's taking up too much time, too many resources. There wasn't enough training involved on both sides. So I think that's why they moved to audio only, at least from my interpretation of it.
One more quick question for Trevor. It's okay, so then I'll take that spot. So I think this last answer pinpointed for me the reason that the insurance companies don't want to support them is because they need to also help provide the infrastructure for these telemedicine appointments, right?
Yeah.
Interesting. Okay. All right, whoops, please join me. What is one more question? All right, please join me in thanking Trevor again for a great talk.
Thank you.